So, welcome to this session. Uh, like the palm, the soul will also show thick skin. Yeah? The soul will also show thick skin, which is meant for protection. It is adherent to the plantar aponeurosis. The skin is thick and it is firmly adherent to the plantar aponeurosis. Is adherent to the plantar aponeurosis. And it is creased so that we can get grip. The purpose of this is grip. Okay. If we look at the various nerves which are there in the sole, supplying the sole, suppose this is the medial side, the great toe. Okay. A small portion here is by the saphenous nerve. Okay. The small portion laterally is by the sural nerve, because sural nerve will continue to supply the lateral border. Saphenous will continue to supply the medial border. So this is sural. And here is the medial calcanean branches of the tibial nerve. And then this portion is divided into the lateral 1.5, which is by the lateral plantar nerve. This lateral plantar nerve behaves like ulnar nerve. And this medial plantar nerve, which supplies the medial 3.5, this behaves like the median nerve. So median nerve, because it behaves like median nerve, it will supply 3.5 digits and very few muscles. While this will supply only 1.5 cutaneous, but most of the muscles of the sole are supplied by the lateral plantar. Okay. If we look at the dermatomes of the foot, the medial border is by L4. Okay. The lateral border is by S1. And in between is L5. Okay. This is how, always remember, lateral border of the foot is L5, L4, and the medial border is L4, lateral border is S5, and in between is L5. Now after the skin, there is superficial fascia. Now superficial fascia is also fiber. Normally we say superficial fascia is fatty, but at few places superficial fascia is fibrous and whole is one. And the deep fascia is divided into 3 parts. The deep fascia is divided into 3 parts, and the first and most important part of the deep fascia is the plantar aponeurosis. Plantar aponeurosis, which arises from the calcaneum, and then it goes and splits. Okay, this plantar aponeurosis is attached to the calcaneum. Okay, and then it's, as we proceed towards the toes, it's split into superficial and deep slits. Okay, the superficial slip is attached to the dermis of the skin. while the deep sleep embraces the flexor tendon. Okay, so the deep fascia has three components. One is plantar aponeurosis, and this plantar aponeurosis will further, be splitting like this for each digit. Okay, so deep fascia, three components. One is plantar aponeurosis. Two is the transverse metatarsal ligaments, deep transverse metatarsal ligaments, and three, the fibrous flexor sheets of the toes. Okay, so deep fascia is modified into three parts: plantar aponeurosis, deep transverse metatarsal ligament. Okay, it is there between the metatarsophalangeal joints and the fibrous flexors sheets of the toes. Okay, so through which the flexor tendon will pass. So these are the three components of the deep fascia. The muscles are arranged, muscles of the sole are arranged in four layers. And now we'll be studying it layer by layer, and then I'll tell you that how to remember which muscle lies in which layer. Now let us study what are the muscles which are lying in the first layer. Muscles lying in the first layer of the sole. When we look at the muscles lying in the first layer of the sole, so suppose this is the calcaneum, always we will be having medial side on this and lateral on this side. Okay, so here in the first layer of the foot is a muscle called as flexor digitorum brevis. Okay, flexor digitorum brevis, and this will be splitting into four tendons for the four toes. Okay, four toes means second, third, fourth, and the fifth toe. In the first layer also is also a muscle called as abductor pollicis, and then there is a muscle called as abductor digiti minimi. Since there is no longus and brevis, we just say abductor pollicis and abductor digiti minimi. Okay, while here is flexor digitorum brevis because already there is flexor digitorum longus. So this is attached to the medial side of the first toe, and this is attached to the lateral side of the toe first. The abduction and adduction is always in respect to the second toe. Okay, is always respect to the second toe. This way is abduction. So abductor digiti minimi and abductor pollicis. Origin, insertion of all these muscles is not there in your syllabus. Maybe you can know their nerve supply. This is supplied by medial plantar nerve. The abductor pollicis longus, abductor pollicis is also supplied by medial plantar nerve, and this is supplied by lateral plantar nerve. So because I said this behaves like medial plantar behaves like median nerve, so it will supply the muscles which are there on the medial side. Abductor digiti minimi will be supplied by lateral plantar nerve. So this is the muscle of the first layer. Okay. Now moving on to the muscles in the second layer. Now the muscles in the second layer of the foot are mostly the long tendons. So suppose this is the calcaneum, this is again the medial side, this is the lateral side. Okay, and coming like this is the tendon of the flexor digitorum longus. Okay, flexor digitorum longus tendon, which again splits into four parts for the second, third, fourth, and the fifth digit. Okay, and the flexor hallucis, which is coming from the lateral aspect and going to the medial aspect. This is coming from medial aspect going to the lateral aspect. Okay, so this is flexor hallucis longus, flexor digitorum longus, flexor hallucis long. Okay. Now to straighten its pull, because it is going like this, so to straighten its pull, there is one more muscle in the second layer, that is flexor digitorum accessoris. Okay. And on the tendon of the flexor digitorum longus are the muscles called lumbricals. Okay, lumbricals. So these are the muscles in the second layer of the sole. The long tendon of flexor digitorum longus with lumbricals and flexor digitorum accessoris and flexor hallucis longus. Flexor digitorum longus supplied by tibial nerve. Flexor hallucis longus is also supplied by tibial nerve. Okay. As regards the nerve supply of the flexor digitorum accessoris is concerned, it is by the lateral plantar nerve. Okay. The lumbricals, the first lumbrical is by medial plantar, okay, and other three lumbricals are supplied by lateral plantar nerve. Okay. Now we move on to the muscles of the third layer of the foot. The muscles of the third layer of the foot are one, like here is flexor digitorum brevis, but hallux and digiti minimi always have their own. So flexor, this is flexor digitorum brevis. So flexor hallucis brevis is one muscle. Flexor hallucis brevis. And then there is one more muscle which has two heads, oblique head and a transverse head, and adductor hallucis. Okay, these are all for the first digit. And then there is second digit, third digit, fourth digit, and there is a fifth digit. Okay. And this fifth digit also receives one muscle, and the name of that muscle is flexor digiti minimi brevis. So flexor hallucis brevis, flexor digiti minimi brevis, and adductor hallucis two heads, oblique head and transverse head. These are the muscles which are there in the third layer of the flexor hallucis brevis. Because it is on the medial side, it will be supplied by medial plantar nerve. But adductor hallucis, like adductor pollicis was supplied by the ulnar nerve, this is supplied by the lateral plantar. Okay. And digiti minimi brevis is also supplied by lateral plantar. So this is about the muscles of the third. I'm not talking about their actions of these muscles because the name itself suggests the actions except for the lumbrical muscle. And these lumbrical muscles, like uh, the upper limb, they cause they maintain the extension at the interphalangeal joint. Okay, that is their action. Now coming to the muscles of the fourth layer, muscles of the fourth layer are the palmar introssei, Okay, and the dorsal interosseous. I draw separate diagrams for that. And apart from palmar interosseous and dorsal interosseous, so there will be palmar interosseous, oh sorry, plantar interosseous. There will be dorsal interosseous, and there is tibialis posterior and peroneus longus. Okay, so the firstly I'll draw the plantar interosseous. Okay, plantar interosseous. Now this plantar interosseous, they are only three in number. They are not four. In upper limb, we had four palmar and four dorsal. Here only three plantar are there. Okay. So suppose this is the first digit. This is the second. So second digit forms the axis. So the palmar interosseous are adductors. Okay. So this is third, this is fourth, and this is fifth. Okay, 1, 2, 3, 4, and 5. Because they are going to cause adduction, they are like this. One muscle. Okay. This is number one. Here in lower limb, they are numbered from medial to the lateral side. Okay. So they go like this. So whenever they contract, they will bring the digit towards the second toe. The second toe is the axis. Towards the second toe is adduction. Away from the second toe is abduction. Okay. So there are three plantar interossei. All the three plantar interossei, they are supplied by the lateral plantar. Okay. Even the dorsal interossei, they are supplied by the lateral plantar. And the two other muscles, tibialis posterior, which is supplied by tibial nerve, and peroneus longus tendon, which is also there in the fourth layer, it is supplied by superficial peroneum. Now let us study the dorsal interossei. Now dorsal interossei, their action will be abduction. Okay, and this is how the dorsal interossei will be. Uh, this is how the dorsal interossei will be. Suppose this is the first toe, or the great toe, then the second, the third, fourth, and fifth. Now this is the axis. Okay, and away from the axis is abduction, and that is the reason that the dorsal interossei, which are bipinnate, they are attached like this. Okay, so when they contract, they will pull the digits away from the second. But then there are two dorsal interossei here also. Okay, the number one and number two. This is 1, 2, 3, and 4. So we may feel that these are attached to both sides of the second digit. So they actually help in moving the second digit medially and laterally. So action of the dorsal interossei 1 and 2 is to move the second digit medially or laterally. And third and fourth is abduction. Okay, so they will pull away. Also, they will cause the flexion at the metatarsophalangeal joint and extension at the interphalangeal joint. All of them are supplied by lateral plantar nerve. Okay. So now let us study the nerves. Let us study the nerves of the soul. Uh, it's very difficult to remember all these muscles at the first, at the outset. And I'll tell you the formula. How do we remember all these muscles before I go for the nerves? Draw a table and write here on the top that the muscles which are attached to the hallux, muscles which are attached to the digits, each layer may show this, muscles which are attached to the digiti minimi, and then there will be some long tendons. Okay. So let's make a chart of all the 4 layers. Okay. So layer number 1. In layer number 1, there are no long tendons. There is flexor digitorum brevis. And then there is abductor pollicis, abductor digiti minimi. Now, the first, I always tell the students, like when there are 3 children in the house, the first child always gets something separate. Then the last one also wants immediately the same. So when flexor digitorum brevis is given to the digits, hallux and digiti minimi, because they are the eldest and the smallest, they want everything separate. So there is flexor pollicis brevis, flexor digiti minimi brevis. And apart from that, there is adductor pollicis in the third. In the second layer, there is flexor digitorum accessoris. And then there are long tendons, flexor digitorum longus, flexor pollicis longus, and on the digitorum, there are lumbricals. There is no muscle attached to the hallux or digiti minimi, of course. This long tendon will go, but flexor digitorum accessoris and lumbricals in the second. In the fourth layer, again, there is long tendons. And these long tendons are tibialis posterior and peroneus longus. Okay. Now, in the fourth layer, there are muscles attached to the digit, and they are palmar interossei and dorsal interossei. So how do we remember? In the second layer, there are long tendons. Flexor digitorum longus, flexor pollicis longus. In the fourth layer, there are long tendons. In the first layer, there is flexor digitorum brevis, and immediately in the third layer, the hallux and digiti minimi get a brevis and adductor pollicis. And abductors in the first layer, adductor in the third layer. Digitorum brevis in the first layer and separate for the hallux and digiti minimi in the third. That is how we remember the muscles in the fourth layer of the soul. Now coming to the nerves. Okay. For nerves, it's not that these nerves are asked in the exams, but if you remember the medial plantar nerve, all remaining muscles are supplied by the lateral plantar nerve. The medial plantar nerve, it enters like this and goes and supplies the medial 3.5 digits. Okay. And very few muscles. It will supply the flexor pollicis brevis, and it will supply the first lumbric. Okay. And it will also supply the flexor digitorum brevis and abductor pollicis. That means it supplies 4 muscles and 3.5 cutaneous digits. The 4 muscles supplied by it are flexor digitorum brevis, then abductor hallucis, then flexor hallucis brevis, and first lumbar. Okay. The remaining all muscles are supplied by the lateral plantar nerve. So I'll not draw a diagram of the lateral plantar nerve. Or in short, if I have to draw something about the lateral plantar nerve, I may just draw a diagram like this. This is the great toe, 2, 3. Okay. And this lateral plantar nerve comes like this, and it supplies the lateral 1.5 to 10 years. It supplies the lateral 1.5 to 10 years. And then it supplies all this. It will supply the flexor digitorum accessorius. It will supply the abductor digiti minimi, and the lateral part of the sole, and then it will supply all the palmar and dorsal interossei, all palmar and dorsal interossei, and it goes and supplies the adductor hallucis also, and also supplies the lumbrical 2, 3, and 4. So lumbrical 2, 3, and 4, adductor hallucis, all plantar. Sorry, I may be saying palmar, all plantar and all dorsal interossei. Okay, so 3 plantar and 4 dorsal, and abductor hallucis, abductor digiti minimi, flexor digitorum accessor, and 1.5. Now talking about the arteries in this area. The arteries in this area, again, like the tibial nerve divides into medial plantar and lateral plantar, the arteries also divide into medial plantar artery and lateral plantar artery. So suppose this is the sole. Okay, the lateral plantar artery comes like this. Okay, and then it forms a plantar arch. Like there is a palmar arch, it forms a plantar arch. This plantar arch gets perforating arteries from the arcuate artery, which is there on the dorsum of the, and it will give arteries. It will give arteries, digital arteries like this, which will supply all the digit. And this digital arteries will again get distal perforating arteries. These are proximal perforating artery where they communicate with the artery, arcuate arteries, and these are distal perforating arteries which communicate with the branches of the arcuate artery, digital branches of the arcuate artery. Okay. So suppose this is the dorsum and this is the ventral surface. The arcuate artery is giving branches like this on the dorsum, and here is the plantar arch giving branches. Okay, so then the arcuate artery gives a proximal communicating branch, and from this digital branch again comes a distal communicate. So there are two communications coming from the dorsum to the ventral part. Okay, so this is arcuate artery which is giving digital branches, and arcuate artery itself gives a proximal perforating branch to the plantar arch. Okay, so suppose this is the plantar arch, it gives proximal perforating branches, and then this plantar arch gives digital branches. These digital branches, they make a communication with the branches of the arcuate on the top, on the dorsum. So dorsum and ventral are connected by two perforating branches, proximal perforating and distal perforating. So this is the plantar surface and this is the dorsal surface. Okay, and there are two perforating. Okay. While the medial plantar artery, it runs like this on the medial aspect, not any significant it just supplies the muscles on the medial side. Okay, so this is all about the sole of the foot, and most important thing in the applied anatomy you should know is plantar fascia. fasciitis. Plantar fasciitis or excess walking can lead to plantar fasciitis where there is lot of pain, especially when while getting up in the morning. Okay. Then there is sometimes fracture of the second, third, or fourth metatarsal, which is called as March fracture. Okay. So now we'll just do a fast revision of the muscles. So So we started with the sole and we said that the sole is supplied by the medial plantar and lateral plantar. When it comes to cutaneous, medial plantar is prominent. When it comes to muscle, lateral plantar is prominent. It supplies only 1.5 lateral digits. The superficial fascia is fibrous. The L4 supplies the medial border, S1 supplies the lateral border, S5, L5 supplies in between. Deep fascia, three components: plantar aponeurosis, deep transverse metatarsal ligaments, and fibrous flexor sheaths. Muscles of the first layer are flexor digitorum brevis, abductor hallucis, abductor digitorum. Muscles of the second layer, in second layer and fourth layer, we see long tendons, flexor digitorum longus with lumbricals, flexor hallucis longus, flexor digitorum accessoris. Muscles of the third layer are the flexor hallucis brevis, flexor digitorum brevis, and adductor hallucis. Okay, with two heads. Muscles of the fourth layer are tibialis posterior, peroneus longus, palmar and dorsal interosseous. Palmar, plantar, sorry, plantar. The plantar interossei are three in number. They move the three digits towards the second digit. Dorsal interossei are four in number. Okay, they move away from the second digit. The other digit. This is the table which we studied how to remember the muscles of the sole. In the second and fourth layer, there are long tendons. In the first layer, there is flexor digitorum brevis. Immediately, the elder child and younger child want it separate. So flexor hallucis brevis, flexor digitorum brevis, abductor hallucis, abductor digitorum, and adductor in the third layer. Flexor digitorum accessoris lumbricals here and interossei. The nerves, medial plantar behaves like medial nerve, supplies 3.5 digits and only four muscles: flexor digitorum brevis, abductor hallucis, flexor hallucis brevis, and first lunar lumbrical. Remaining all muscles are supplied by the lateral plantar nerve, which only supplies 1.5 digits. All muscles: plantar, three plantar, four dorsal interossei, three lumbricals. First one is by medial plantar and adductor hallucis and abductor digitorum minimi. And arteries are the medial plantar artery, the lateral plantar artery. Lateral plantar artery forms a plantar arch, which gives digital branches. This is proximal perforating from arcuate artery, and distal perforating are received again from the digital branches of the arcuate artery. In the applied anatomy, plantar fasciitis and March flexure. Thank you so much. Please watch this video. Please like and subscribe. And if there are any changes, corrections in the video, I put it in the description. Please do read the descriptions every time. Thank you.